Okay. The Committee on Public Administration and Appropriations, this meeting is now in public and we are now live. I don't propose to rehash the jurisdictional parameters of this committee. I think I've done so adequately and the public understands it. The purpose of this meeting is to continue the inquiry into the state's acquisitions of pharmaceuticals as it relates to the current processes applicable to its importation and approval. The role of the committee is to assist the stakeholders in achieving the efficient delivery of services while ensuring that expenditure is embarked upon in accordance with parliamentary approval, determine the challenges being faced and possible solution to these challenges, and make recommendations for improvement of public administration. The jurisdiction of this committee is clearly set out in the standing orders of the committee, which created this committee, and I don't propose to rehash them. As was in the past, we have with us the Ministry of Health, we have the Chemistry, Food and Drugs Division, the National Insurance Property Company Limited, the Office of Procurement Regulation, and joining us again today is the Private Pharmacy Retail Business Association. As you would recall on the last occasion, in full adherence and due regard to procedural fairness and the principles which adumbrate procedural fairness, because of the nature of the evidence which emerged, we took the precaution of sending correspondence to the former minister, Mr. Terence Dialsing, Mr. Derek Patron, Mr. Imtiaz Haider Ali, and Mr. Faz Khan. I want to thank them for their responses, and I want to thank Mr. Dialsing, Dr. Patron, and Mr. Imtiaz Ali for their attendance today. However, we have received a rather fulsome memorandum of evidence from Dr. Patron, and we are very grateful for that, together with the accompanying exhibits and appendices which he attached. We have received something from Mr. Haider Ali, but thus far we've received nothing from Mr. Dialsing. It is the practice of this committee, Mr. Dialsing, that we do not entertain evidence simply given to us orally. We would require a written memorandum of evidence, what purports to be your evidence. For the simple purpose, it creates the written record, and secondly, it allows members of the committee to prepare in their task of probing the evidence which is given. All right, that's the practice of this committee. However, whilst we thank you for attending today, the members of the committee, having discussed this, we intend to explore in some greater detail the evidence which emanated from NIPDEC on the last occasion, and we wish to probe that evidence some more. So what the committee has decided is that when the full evidential picture has been painted, we will deliver a full transcript of all the evidence to anyone against whom adverse comment has been made, or against whom any comment which may be perceived to be adverse to that person, so that they may be given an opportunity to respond in a comprehensive manner to all the evidence. We do not intend to approach this inquiry by the reception of evidence and the adduction of evidence in a piecemeal or ad hoc manner. We propose to be fairly systematic about it, and we are of the collective view that if we start to entertain and receive evidence in such a piecemeal fashion, it will unnecessarily complicate the proceedings and truncate the reception of evidence. So we propose to keep the adduction and reception of evidence in a very structured and organized manner. So we're very sorry we may not get to some of the persons today. depending on the questions my colleagues have. But the batting order is we propose to start with NIPDEC first of all. And whilst we do not have Mr. Asif Ali here or Mr. Hasmat Ali, because we've been informed that they've been moved from their substantive positions, the position of this committee is that having regard to the evidence which has emerged so far, those two witnesses are not witnesses, procedural witnesses, where any other member, like for instance, the acting permanent secretary, can give the answers on their behalf. I think it would be unfortunate and somewhat disadvantageous, if I want to use a neutral term, to misfortune to put her in that position. This committee views Mr. Hasmat Ali and Mr. Asif Ali not merely as procedural witnesses, but as witnesses of fact, and who will be required to attend in person and to explain the evidence which flows from certain documents, which Senator Nakid has assured me that his ever-expanding mailbox received a substantial deposit this weekend, and I must confess I'm a cursory reading of those documents which were deposited into Senator Nakid's mailbox. The evidence is quite concerning. It's alarming to some. Some might put an interpretation of alarming, but it's some concern. Not quite yet, but we will get to them. Some have been circulated by Ministry of Health, but I was lucky to receive a copy from Senator Nakid, and in due course, all the members of the committee will get a copy, I am assured. So I wish to start this morning with Mr. Rampoli, this afternoon, I'm so sorry. So, Mr. Rampoli, can we start with you? And so that we get back to where we were, so that for the benefit of the listening public, the viewing and listening public. I think where we started and where I want to start is that you gave an answer where we ended, and that's where I want to start. So it's like the resumption of an overnight innings in the morning. In a 5-day test, when you come back the next morning, it's the resumption of the innings. Okay, shall we describe it as that?
Sure.
Thank you. So on the last occasion when Senator Nakid asked you a very pointed question, Senator Nakid, for the refreshment of the memories of the members of the public, can I invite you to start there?
Thank you, Chair. So Rampoli, my question to you last time, when you indicated that there was some amount of, for want of a better word, pressure placed on officials or on concerning one company in particular. And the question was asked by the chair. Since the Ministry of Health was present, you stated was present, we asked you, who was the Minister of Health who would have given instructions to you to prioritize payment to a certain company, a company called Aventis, that had $100 million in US in business. And you stated that the minister at that time would have been former Minister Terence Yalcin. Is that correct?
So there were meetings with the ministry and the executive of the ministry, and present at those meetings with the Minister of Health at that time in terms of prioritizing payment to suppliers, Aventa being one, and the other major suppliers.
Well, the question we would like to ask, did the minister at any point in time specifically state in those meetings that he would like those payments prioritized to Aventis?
So there were allocations based on the funding that they received from the Ministry of Finance, and based on those allocations, they would prioritize the major suppliers to receive funding, yes.
Mr. Rampoli, correct. I would like to explore these meetings. How were the invitations sent for those meetings? Was there a set, first of all, was there a set time for those meetings?
No, there was no set times. Those meetings were called based on via emails, requesting a meeting with the ministry, with the minister, to discuss payment allocation to
Right.
suppliers.
And were those meeting, was the venue for the meeting in the email?
Yes, they were in the meeting, in the emails, yes. Minister's conference room.
Okay.
Meetings were held. Yeah.
And the invitees to the meeting, can I just stop for a minute and recognize the entrance of Mrs. Camille Robinson-Regis, a member of this committee?
Thank you. Good afternoon, Mr. Chair.
Thank you very much for your attendance,
Thank you.
Mrs. Robinson-Regis.
Most welcome, Chairman.
All right, so can I now, Mr. Ramphali, the attendees to the meeting would have been copied on the email. Am I correct?
That's correct, yes.
And in those meetings, were formal minutes taken of those meetings?
No formal minutes were taken.
And there was a discussion about payment?
Yes.
The permanent secretary was there?
Permanent secretary was there, yes.
And that would have been Mr. Asif Ali?
That's correct.
And your director of finance at the time would have been Mr. Kowlessar, who sits to your right?
That's correct.
Mr. Kowlessar would have been in those meetings?
Yes.
And Mr. Kowlessar would have heard that officials from the ministry, in the presence of the minister, give instructions to prioritize payments to the bigger companies?
Yes, he was at those meetings, Chair.
Yes. I have read some of the documents in the short time that I had to read it. And for the correction of the public record, at that time, the company was known as Smith Robertson, was it not?
That was one of the companies, yes.
Right. Yes, it was one. As a matter of fact, let's bell the cat a bit, shall we? And get to the meat of it. Let's start to go through these companies. The companies which were given priority were AA Lakis Limited. Would you agree with me? I'm going to call out a list of companies that were given priority.
Yes.
And then I'm going to read from an email where Asif Ali gave Mr. Kowlessar instructions on several occasions to bump up the amounts of some vendors, to take away the allocation for some vendors, and to concentrate on the bigger players and factor out the small players. That's the exact word used in the email.
That's correct.
Right. So let's go through these companies, shall we? AA Lakis. Am I correct?
Yes.
Alston's Marketing Limited. AP Scott Limited.
Yes.
Bryden Pie Limited.
That's correct.
Massey Distribution.
Yes.
Am I correct?
Yes, you're correct.
NWT Enterprises Limited.
Yes.
Superior Pharma Limited.
Yes.
Vernon Technologies Limited.
Yes.
And Smith Robertson Limited.
Yes.
Those were the companies that the NIPDEC was instructed to give priority to payments.
That's correct.
Mr. Kowlessar, can I just switch to you for 1 minute? You're right here, you're listening to the evidence.
Yes, Chairman.
Is your general manager correct in his perception of the evidence which he's giving to this committee?
Yes, he is correct.
As a matter of fact, Mr. Kowlessar, am I not correct that the emails were directed to you as finance manager?
That's correct.
And Ms. Smith was copied on many of them. Am I not correct?
Correct.
Am I not correct as well that NIPDEC would sometimes prepare the estimates of what NIPDEC thought ought to be paid and then they would get instructions to change it from the ministry through Mr. Ali at the time?
That's correct, Chairman.
As a matter of fact, am I not correct that by email a thread starting on the 6th of October 2023 and ending on the 10th of October 2023, an email from Asif Ali to you, Jabari Kozia, where the subject is tranche number 1, 311 million loan utilization. Okay? Am I correct?
Correct.
The thread references a $311 million loan and an allocation of $110 million.
Correct.
Right? Well, we get to the 110 million just now. Out of that, farm suppliers were to be paid $80 million out of that 110. Reimbursement of NIPDEC funds was another 30 million, so that makes up the 110. All right? Let me ask you this. Out of that 80 million, out of that allocation and that 80 million to pay farm suppliers, how much of that 80 million did Smith Robertson receive?
Smith Robertson, I believe, received 50 million.
50 million. Close to half the money. 50 out of the 80 or 50 out of the 110?
50 out of the 80.
50 out of the 80. One company received $50 million out of the 80 million. Now, you're a fair man. Would you consider yourself to be that, Mr. Kosher?
Yes, Chairman.
And you would have known that across the pharmaceutical sector, that there were companies who were hurting and had their monies outstanding for a long time. Would you agree with me?
Yes.
Would you also agree with me that the smaller players, their invoices were far in excess of 90 days outstanding for a very long time? You agree with me?
Correct.
Some of them had invoices outstanding 180 days. Would you agree with me?
Yes.
As a matter of fact, let's cut to the chase. A lot of the smaller players, their invoices were outstanding for quite a long time. 180 days, 210 days, months, if not years. You agree with me?
Yes.
But yet, NIPDEC was being instructed by the accounting officer of the Ministry of Health to pay one company 50 million out of an 80 million allocation? Mr. Kosher, this is no fault of yours, you know. Well, I want to make that clear. Nobody's ascribing or laying blame to you or laying blame at your feet. You did what you were told. Am I not correct?
That's correct.
As a matter of fact, NIPDEC's recommendation for the distribution of this $80 million was far more equitable in your view. Am I not correct?
Yes, that's correct, Chairman.
And you tried, NIPDEC tried as best as it could to distribute the money across the board fairly evenly.
Yes.
Am I not correct that despite your best efforts for an equitable distribution of this tranche of money, you were nevertheless instructed, and it's on email, right? We know that. You were nevertheless instructed by the accounting officer in the Ministry of Health to disburse the money in accordance with the wishes of the ministry, accounting officer of the ministry. Am I correct?
You're correct, Chairman.
Right, so 80 million going. How was the other 30 million split? Do you have any recollection of that?
Well, we would split it based on the balance. We would split it proportionately depending on how much was outstanding based on over 90 days with
Right.
the suppliers.
Right. Do you recall the names of two companies, Quelco and Summit Cosmetics?
Yes.
Were you directed by the ministry, the permanent secretary in the ministry, via email, dated 9th October 2023, where the permanent secretary told you, I find that the payment on AP Scott is low. Shall I find that email for you? Or would you recall it?
I recall it.
Is my language correct? Is my recollection of that email correct, Mr. Kosher?
Yes, you're correct.
Where the permanent secretary told you, I find that allocation to AP Scott is low, bump it up a little, right? And leave out Quelco and Summit. Pay Quelco and Summit 0. Am I not correct? Is that a correct, fair assessment of what you were being told by email to do?
You are correct, Chairman.
So two companies who NIPDEC found it was fair to pay a certain sum of money, but then instructed not to pay those companies any money at all, but to redirect those funds to the payment of the bigger players in the sector. Am I not correct?
Correct.
Do you recall receiving an email where you were copied from, again, Mr. Asif Ali, in which this is the language? Please readjust, factoring out small, medium suppliers who will pay over 60 days from our allocation, with the large suppliers being paid from loan funds.
Yes, I remember that even.
I want some background into that. How that happened?
Well, we were given the amount to pay, and based on that, we would send them an allocation based on our proportionate measures based on over 90 days. And we would send that allocation list to the ministry. Then the feedback was written to us stating to make those changes.
Right. So despite what could be said to be a palpable and plain attempt by NIPDEC to adopt an equitable payment scheme, NIPDEC's proposals were rejected out of hand by the ministry. Is that a fair assessment?
Yes, Chairman, that's a fair assessment.
Then there is, I want to go further, you know. I want to go further a little bit. There is a $30 million payment. You recall that? That would have been an exchange of emails starting February 28, 2024 to March 26, 2024. You recall that thread of email?
I believe so, Chair.
The subject is the revised tranche 3 payment schedule under $311 million loan facility, right?
Mm-hmm.
You recall that?
Yeah.
Now, without getting into the specifics of it and all of that, do you recall an email by which Mr. Asif Ali, the accounting officer of the Ministry of Health, was asking for Massey to be bumped up? This is the word in the email. Bumped up to 10 million?
Yes.
And then Mr. Ali says that they can do 100 million, with 25 million to be allocated as follows. Smithrop 9, Superior 3, Vernon 4, Massey 2, Bryden 3, Alston's 2, and NWT 2. We're assuming that that means millions, right?
Correct.
So throughout all these email, exchange of email, every payment that NIPDEC had to make had one to be approved by the ministry. the accounting officer in the ministry. Is that fair to say?
Yes,
And two, the amounts had to be paid. The amounts had to be set and agreed to by the accounting officer in the ministry. Is that a fair and correct assessment?
that's correct.
I am to announce that Minister Hussain and Minister Maraj did ask to be excused because of an urgent matter that they've been called away. But we are queried, so we'll continue. I have another issue which I wish to take up for you, and then I will turn over to my friends, to my learned friends who are on the committee with me. There are two issues which I want to pursue. And then we'll come back to another issue. And it has to do with this. Am I not correct that there was a lot of disquiet in the pharmaceutical industry with the smaller players claiming that they were being discriminated against insofar as payments were concerned? Mr. Koja, Mr. Ramphali, you can both answer individually or collectively.
So there were times that we used to get calls and requests via emails seeking audience with us, yeah, with regard to payments, yeah.
But of course, the final decision for payment did not rest within the bosom of NIPDEC to make those payments. You would agree with me?
That's correct.
Mr. Ali, who was the accounting officer in the Ministry of Health, do you recall him sending any email inquiring about the status of payments for companies? Either one of you can answer, but Mr. Koja, I think this is more suited for you to answer.
Yes, I did receive an email asking for status.
Yes. Which companies those inquiries were made on behalf of?
It was for Vernon and Superior Farm, I believe.
And those were two fairly large companies,
That's
right?
correct, yes.
As a matter of fact, Superior Pharma their business exceeded over 60 million with NIPDEC. And Vernon Technologies their business was, I have the figures. For these purposes, it's not entirely important that we go into those figures, right? But Vernon Technologies also was the beneficiary of the administrative largesse of the Permanent Secretary. The graciousness of the Permanent Secretary to send an email inquiring about the status of payments to these two companies.
Correct.
I have looked through the cache of emails provided by Senator Naked, and I am yet to find any email where the Permanent Secretary inquired about any small or medium-sized
Mr. Chairman, could
company.
I just ask a question, please?
Of course.
Isn't it a little disingenuous for you to use the term administrative largesse?
Well,
It
it's
seems as though you are
characterizing them.
characterizing.
No, that's my own somewhat colorful way of describing it. But I could use, if you object, I could perhaps use a more neutral term.
I think that would be fair.
Thank you very much. Or shall we say this, right? Shall we call it administrative alacrity? That's acceptable to you, member?
I don't know if alacrity is the right word either, but
Shall we
feel free,
say,
Mr. Chairman.
shall we say, did you receive, I think we've established that you've not received any email from this accounting officer inquiring about the status of payment to any of the smaller or smaller companies?
No, we didn't receive an email.
Yes, Minister.
Given that answer, then let's say selective largesse.
Selective largesse? I
Largesse is the word that has me a little concerned.
Oh, largesse is good.
shall we say, the beneficiary of administrative probing? Mr. Kosher, I have looked over some numbers which we have received through Senator Naked here. And what strikes me is that consistently throughout all the payments was that this one company, Smith Robertson, consistently received payments which would have amounted to somewhat between 40 and 50% in some instances, and that's the lower. Consistently. You need to put the answer on the record.
Correct. That's correct, Chairman.
And whilst other companies, similar large companies, would have received, in some instances, 12%, 10%, 15, 20% of their outstanding balances of the allocation, the sums that were allocated. For some reason, the accounting officer in the ministry kept insisting that Smith Robertson be paid anywhere between 30 to 60% of the allocation. Is that a fair assessment of what the financial records disclose?
Yes.
Senator Naked? Yes.
But you know, I like to break it down for the public. Given all that we've heard now, at any point in time, was there any queries within the organization, within the NIPDEC, as to the Ministry of Health, or those people involved in this selective, we don't want to use largest, this selective offering? Were there any pushback against that? Because obviously this is beginning to sound to the listening public, the viewing public, that something is amiss here. So was there any pushback? I would like to know just the thinking within NIPDEC. Was there any pushback against this? Because remember, we have all these mom and pops, all these family-owned pharmacies being excluded.
Clarity.
Yes?
I thought the payments we were talking about were to suppliers. I just want to make sure I understand. I heard Senator Naked refer to small pharmacies.
Yeah, these are
we speaking about pharmacies or suppliers?
Well, suppliers fall into two categories. If you recall, there's the large pharma and there's also the CDAP. And I had taken pains to ask Mr. Kosher that there were two components to it. So that whilst the small pharmacies remained somewhat financially undernourished in that sense. I think that's what Senator Naked is pursuing.
Correct.
So whilst the CDAP monies due to the small pharmacies under the CDAP program were left to languish, the payments to the big pharma, it appears that's how the evidence is emerging. So I think that clarifies it, Senator.
Yes.
So no, just for me to understand. So when we were talking about before about the 40 to 50% payment to Smith versus others, the others we're talking about are suppliers or the CDAP pharmacies?
Both suppliers.
Well, I guess my concern or my confusion would lie in the fact that we were not provided with these emails. I don't know what we're talking about in terms of other similar large companies receiving 12 to 15%. I would need clarification on that.
Senator Naked, do you have an additional copy which we can provide Senator John Baines?
Yes, you can ask the Secretariat to
Yes.
make copies for them and provide them.
Yeah, if I may, Mr. Chairman, I have a concern that we don't have the emails either. So we are.
It will be distributed, and as I said.
No, it would have been fair if we had the emails so that we could refer to the emails at the same time that you will.
Remember, I accept that, but the problem is I did not make the copies.
You did not?
I did not receive these documents. These documents were received by Senator Naked. Had I
Okay, but-
received them in my capacity as chairman, I obviously would have distributed to every member.
If it's something that the committee is being asked to refer to, and all members of
Yes,
the
of course,
committee should be
I think all members
happy
will.
them with the, so
I-
that we could all be on the same page.
We will undertake to distribute it to everyone.
Yes,
But
Chair, and
let's not hold
it
back.
makes a fairly easy reading.
Yes, let's not hold back Senator Naked. Not that he's easily restrained.
So, yes, was there any pushback from, given that you've seen all of the selective,
Yes, the
Appropriation.
pushback would have been always sending the ministry our recommendation to allocate it to the other, to everybody to get a proportionate share of what was being paid. So that was our pushback. We
so in
consistently
your
did
attempt
that.
at fairness, what was the then response of the ministry then? In your
Well-
attempt to
well-
seek equitable distribution of funds?
Well, the response is there were the changes made to our recommendation.
They were the what, sorry?
Their response was the change to our recommendation.
Your mic.
Thank you. The list you would have sent, that would have been based on what perspective or policy? I want to believe it will be based on some kind of guidelines.
Yes.
Am I correct?
So we focused on the over 90 days, the holders of the invoices, and based on the amount received, we applied against the balances outstanding for the suppliers and allocated it proportionately
Across the board?
across the board, correct?
And then when, is it that you would have sent that recommendation, or you would have then, after you receive what the ministry would have sent, you would have said, this will be better applied, or it will be better applied this way?
Well, there were times where initially we would send the recommendation, but there were other times where we were told initially, this is the amount that a particular supplier would get, and then we would allocate the rest accordingly.
Okay. So the ministry will say, did you then ask why, or you just accepted that as an instruction
We accepted that as an instruction,
and proceeded to pay?
correct?
But just, sorry, member, just one last question. NIPDEC, you represent several ministries and probably agencies in your business. You act as project manager, am I correct?
Correct.
How long, are you still with NIPDEC? Are you still working there, Mr.
Yes.
Kuzier? Okay, how long have you worked there?
10 years.
10 years. Is it your experience that ministers sit down and direct how payments are allocated?
No.
So this was a novel approach? No, please, let me ask my question. You can ask your questions after, madam.
I'm sorry.
You can ask your questions after.
But that is not the evidence, Mr. Chairman.
Well,
The
what-
evidence was never that the minister directed. The evidence, Mr. Chair, through you, was that he received the emails from the permanent secretary. So I would just like that the witness be asked questions as per the evidence.
Madam, with the greatest respect, you can ask me, tell me what to ask. You can ask
Okay,
what you
but
wish
you're
to ask.
misleading the witness.
You can feel very free to ask whatever you want to
that's a
ask,
serious
okay?
allegation to
Okay, you could ask, you're here as an equal member. There's no greater or smaller. You could ask whatever you want to ask. Don't
Let's
interrupt
not-
me, please. Thank
Let's
you.
not quarrel about that.
I'm not quarreling.
Minister, ask your question.
Please, you ask a question here when the time comes. I'm just asking. I ask again. Based on your 10 years of experiences, spanning several administrations, is it normal for a minister to sit and direct how payments are made to suppliers, to specific suppliers?
No.
Thank you.
I just want to clarify one thing as well. Just a minute, Senator Reid, please. Because I just found the attachment that I was looking for. As a matter of fact, when that $100 million payment was made, your recommendation, Mr. Kosher, was that Smith Robertson be paid $20 million. Was it not?
That's correct.
And you then received instructions to change that 20 million to increase it to 30 million. Am I not correct?
That's correct.
Senator John Bates?
It's not normal to direct, that the minister would direct how payments are made. Yes?
Correct.
And in response to the chairman before, when you were being questioned about the emails, you indicated the emails came from who?
Permanent secretary.
Was Mr. Dial Singh copied on those emails?
Not in that one, no.
Okay, thank you.
Just now. But did I hear in the members or some member evidence that it was said that the former Minister of Health sat in those in meetings, and those meetings were held or within the context of the meetings or in the within that space of that meeting, that time frame, that instructions were given in terms of how to pay specific suppliers?
That's correct.
Okay, so any writing to the accounting officer, that's a matter of course. That's how it's done, no? Am I correct?
Correct.
But you're talking about a live meeting. There is where the instructions came. Am I correct?
Correct.
I thank you. Yeah.
So let's go back to Mr. Ramphele for that. Let's so that it becomes, so that we get some kind of factual clarity here, Mr. Ramphele, okay? The meeting is convened. There are several people there, included in which are officials from the Ministry of Health. The accounting officer is there. The minister is there. Am I correct?
Yes, you're correct.
And in that meeting, the prioritization of payments is discussed.
That's correct.
And the instructions to prioritize payments for the big players, and I call out the names. Shall I go through it again? AA Lackey's Limited, Allston's Marketing Limited, AP Scott Limited, Bride and Pie Limited, Massey Distributors, Smith Robertson and Company Limited, and NWT Enterprises, Superior Pharma, and Vernon Technologies. Those were the names that were mentioned. Am I not correct?
Yes, you're correct.
And those names were mentioned by whom?
In discussions with the team, with the executive, the minister, PS.
So when those discussions were taking place, was the minister there?
Yes, Chairman.
And it was the minister who gave the instructions, and like anything else emanating from a ministry, the writing comes from the accounting officer.
That's correct.
Right. So in your experience in receiving correspondence from ministries, how often do you receive correspondence signed by the minister himself?
I have never received correspondence from the minister.
Isn't your experience
The permanent
that the
secretary.
permanent secretary carries out the instructions of the minister, and the permanent secretary would write as the accounting officer, especially where it concerns expenditure?
That's correct.
Senator Nakid?
No, I think
Yeah.
before.
Yeah, Mrs. Robinson
Thank you,
Regis?
Mr. Chairman. Mr. Ramphele and Mr. Cozier, can I ask whether payments were prorated, given that the large suppliers would have been owed much more than the smaller suppliers, and perhaps for a longer period, and consequently, even if you made recommendations that the payments would have been prorated over time?
Yes, they would have been prorated. All the payments have been prorated.
Thank you very much.
Good?
Based on what you all just said about the minister being present, at any point in time in those meetings, did the minister object? So did he say, well, you know, the permanent secretary went astray, he didn't know what they were doing? Did he say that? Or did he let everything flow, according to what you said? Did he let everything pass? Just to clarify.
Well, everything was discussed at the meetings and was approved, but I guess and then emails are sent to confirm the discussions.
So the minister would have approved everything that was said in that meeting, to prioritize.
Well, yeah,
Oh.
it would come in writing from the PS subsequently.
So I just wanted to clarify that for the public.
Let's, for the benefit of members of the public, view and a listening public, let's add some kind of context of time. can you recall when this meeting took place? I think I have the email here. It would have been sometime in 2023, wasn't it? The meeting in the conference room. Would that have been around October 6th?
Yes, Chairman.
Right, so that's meeting. But prior to that, on July 17th, 2023, in an email thread starting on July 17, 2023, to July 20th, 2023, in an email from Asif Ali to you, Mr. Ramphele, and Mr. Kosher, you were copied on it as well, and other people. And shall I get that email? Because, let me find it, so I can read all the members who were copied. No, just now, I want to actually read that email. If you all could just bear with me for 1 second. Right. So the participants in the thread are Asif Ali, Jabari Kozia, Anissa Doodnath-Siboo, and I'm going to call everyone who appears on this thread, okay? Roshan Parasram, Terence Dial Singh, Vyas Ramphele, Nigel Romano, Alexis Smith, Avinash Mahabir Singh, and the subject is deliverables from Ministry of Health. So this thread takes place on in the period July 17 to 20th, 2023. And in that email, Mr. Romano, who I assume might have been the chairman of NIPDEC at the time?
Yes.
Am I correct? So this is what Mr. Romano, in summarizing what took place at the meeting. Dear colleagues, I believe we had a productive meeting today. Here are the agreed deliverables. 1, Avinash to send the project specifications for the inventory management system based on RFPs for SALMI and NCOM to the Ministry of Health by Friday, July 21st, 2023. I, that meaning him, Mr. Romano, am to write to Minister of Digital Transformation, copying the Minister of Health, updating him on the CDAP ID project and the need to move forward. He then sets a deadline for himself. 3, Jabari to prepare a suggested allocation for payment of $30 million to suppliers and send to the Ministry of Health by Wednesday, July 19, 2023 at 12 noon. Mr. Kosher, did you send that $30 million allocation?
Yes, I did, Chairman.
Right. And you did so by email dated July 20th, didn't you?
Yes,
Right?
I sent it on the 19th.
Right. And in that email, you set out, you attached a statement. Am I correct?
That's correct.
In that statement, you identified the vendor ID number, the current amount. You then broke down the outstanding invoices between 1 to 30, 31 to 60, 61 to 90, over 90, and a balance. Am I correct?
Correct.
And then you set out a number of payments to other suppliers, which included not the ones that I had referred to earlier, but included companies like Suncrest International, Pharmaceuticals. We need you to say yes or no for the record.
Oh, sorry. Yes, Chairman.
Pharmaco Industries Limited, Medi Supplies Limited, I'm going to read out the smaller companies. The Medical Supply Company, Park Distributors Limited, Physicians Pharmaceuticals, ICU Ophthalmic and Medical, Chemrad, Western Scientific, RD Global Limited, BPI Genetics, Healthcare Caribbean Services, Analogic Solutions, Quelco International, Shine Distributors, and FarmTech, right? Some of them. Except for two companies, you had proposed, NIPDEC had proposed payments of small amounts to those small suppliers. You agree?
Yes?
Other than Smith Robertson, Bride and Pye, Massey, NWT, and I think, could you step outside with that phone, please? And AP Scott Trinidad Limited. Did any of these small companies benefit from this $30 million allocation?
Yes, they did.
Which ones?
All.
All were paid?
All were paid, yeah.
Right.
Mr. Chairman, may I ask a question, please?
Yes, of course.
Mr. Rampley and Mr. Cozier, would you be able to say if from the amounts that NIPDEC got through the loan, apart from some of the smaller companies benefiting, would it be true to say that the ministry also paid the smaller companies? Would you know?
The ministry, yes, would have paid the smaller companies out of the
Ministry allocation?
ministry allocations from the consolidated fund.
Okay, all right. Thank you very much for that.
That's a fair enough question. Mr. John?
Mr. Cozier and Mr. Rampley. I just want to go back, return to member Regis Robinson's question on prorated. Sorry? Robinson Regis, sorry. Yeah, I know you're so long. I'm still calling him wrong. Sorry. The member asked if payments were prorated. I think it was a very direct question, and you said yes.
Yes.
Okay. What do you understand prorated to mean, please?
Prorated means based on the proportionate amount of that was outstanding, you allocated based on that proportion.
All right, that's not, okay, fine, because I've looked it up here, and it says the same thing, right? To divide something in a proportional way based on time, etc. So if that is what you say is correct, what I'm saying, if that is so, then I'm saying the payments, whether to the butcher, baker, candlestick maker, if they were being prorated, whether larger or small suppliers, how will prorate this, the larger contractors, it will be based on time. So if you have accumulated amount of money owed to them, but based on the 90 days, is that the measuring stick you use? That with the larger ones, will you say, well, okay, this is 90 days, so I'll put that forward as I'll put forward the smaller contractors, the suppliers?
The majority of our suppliers were over 90 days.
Over 90 days. So you'll put forward all?
Yes.
But having done so, you then will be told just to pay these specific ones? Never mind, they all ascribe to the 90 days or over?
Yes, you would be told to pay an amount based on one specific value, yes.
So they were excised, the larger ones, and you were told to pay?
Yes.
Okay, fine, thank you.
Both Mr. Rampley and Mr. Cozier, what you have told us here, the figures don't lie, and it's a matter of audited records at NIPDEC. Am I correct?
Yes, Chair.
So that if the committee were to ask for comprehensive month-by-month breakdown or quarterly breakdown, would the actual payment evidence corroborate or support what you have told us here? That the larger players were consistently singled out to receive the lion's share of the allocations and the drawdowns?
Yes, Chairman.
Thank you very much. Minister Baptiste?
Chairman Shu, just to be clear, is it your evidence that the larger pharmacies received favored
Pharmaceutical companies.
pharmaceutical companies receive favored treatment. And I say favored in the context of as compared with the others. They were singled out and given favorable treatment as compared to others.
They were given favorable treatment really because over 90% of the supply chain come from the large to medium suppliers.
Right, so as we're on that, let's talk about some supply chain issues, because that is one of the concerns this committee has. But speaking for myself, as we all know, concentration of supply chains can be detrimental, both from a business perspective and a national security perspective. Are we agreed on that?
Yes.
And I think the anecdotal evidence will bear us out on that. So much so that when COVID came and computer chips could not be manufactured, it posed a serious danger to the markets because of the shortage of computer chips. Am I correct in my assessment of the geopolitics of supply chain management?
Yes.
Right. So wouldn't you agree with me, and this has to do with the efficiency aspect of our jurisdiction, that the concentration of a supply chain into a few companies creates what can be referred to or can be conveniently described as a supply chain choke point in the provision of pharmaceuticals to the national community?
Yes.
Wouldn't you agree with me, Mr. Ramphele, and you've been at NIPDEC. NIPDEC manages the country's pharmaceutical stocks to a large extent. Am I correct?
Yes, that's correct.
Wouldn't you agree with me that it makes a lot of sense for a diversification of the supply chain and a spreading of the supply, the risk across the supply chain to be spread, so that no one company or no one small group of companies can hold the healthcare system to ransom?
Could be, yes, that's correct.
And I want to pursue something about generic drugs right now. Yes.
Clarity. So you have some companies, a small set of companies, getting a lion's share of the imports, and then lion's share,
Not any of the lion's share of the?
imports.
Oh, imports. Okay.
And then these same companies now are being given preferential treatment, if you wish, in terms of payment. So it seems that the system is facing a double whammy now, that you're given this set of companies that's sort of priority, and then you're giving them priority in payment also. Is that true, sir? I mean, would they true you, sir?
I think it could direct the question to the gentleman.
Through the chair to...
There are three of them. Huh? So the three goodly gentlemen from NIPDEC can answer that question that the minister has posed.
Yes, I'll agree.
So,
May I
Mr.
ask a question, please?
Yes, of course.
Isn't it a fact that if they were the ones supplying most of the medication or most of the drugs, that it was obvious that they would be owed the most, and obvious that whenever NIPDEC received funds, as we said before, it would be prorated in such a way that obviously they would get most of the money?
That is correct.
Chairman, through you again, if you don't
Okay,
mind.
but
Sorry, wait, please finish. Sorry.
isn't it also true to say that these companies had been in the business of supplying these drugs much longer than some of the other companies who were recent additions to the pharmaceutical industry. And consequently, if they did in fact have the lion's share, it would have been based on the fact that they had been supplying drugs to the hospitals and to CDAP, over a larger and longer period of time.
Yes, that's correct.
Thank you.
Chairman, two things I want to give clarity on. Now, prorate means you can prorate over a quantum. But if there's sort of staggered payments, 90 days, 120 days, 180 days, I think prorating, if the longer you keep people's money, I think the time has to come in prorating also.
I think we can discuss the merits and demerits of the time value of money. That's a well-known economic concept. But I'm not entirely sure that we could
Do it here.
do it here. But of course, that's for NIPDEC and suppliers to do. They can undertake a study as to the time value of money. We all know that money has a time value, and unpaid debts, as we all know, can be relatively detrimental. But I want to direct some...
Mr. Chairman, just let me say, we had a definition of prorate that was agreed to, a definition that was laid before us by the minister.
Well,
And I think all of us, I don't think we need to go into what prorate means. We know what prorate means, and the members there agreed.
all right. I think we can move to a perhaps less contentious subject than that. But for that, I would want to ask Dr. Patron, but very shortly, and I want to direct a few questions to Mr. Solomon with the permission and leave of members of the committee. Mr. Solomon, you are the medical supplies coordinator. Would you agree with me that the system as currently obtains, it's an unhealthy and untenable concentration of market power in just a few companies?
Yes, I agree.
Would you further agree with me that this unhealthy and untenable concentration of market power is as a result of fundamentally policy adopted by the Ministry of Health insofar as registration is concerned?
With regards to the registration, we rely on registered.
Yeah, no, I accept that. And we'll get into that just now. But the stringent requirements of registration and the adoption, but perhaps you're not the best witness to direct this to. But my question to you has to do with the overall supply chain architecture of pharmaceuticals in this country. That it seems to me what we are hearing here is that the vast majority of pharmaceuticals brought into the country for the public health system and for sale in the private health sector is being controlled by a small number of companies.
Yes, I agree.
All right. So now that we've gotten that, I would want to ask Dr. Patron if, I think for now, we would excuse NIPDEC, and if they could perhaps...
Mr. Chairman, just before you excuse NIPDEC, may I direct another question to Mr. Solomon? Mr. Solomon, with regard to the breadth of companies that would participate in supplying pharmaceuticals and medical supplies, isn't there a concern that we need to be stringent in who or what companies we open this up for the safety of patients and the safety of the public?
Totally agree.
So
with
you
that.
have to be stringent.
Yes.
So you have to be able to limit the companies who participate. It can't be a roofing company participating in medical supply chain.
I agree.
Am I correct? Okay, thank you.
Is your answer that you have to limit the amount of companies, or you have to ensure that companies bring products which meet a stringent market requirement? Am I not, is it more accurate to describe it as such?
Yes.
So I want to now go to Dr. Patron, if the members of NIBDEC. We're very grateful for your frank and forthright answers. And if we could invite Dr. Patron, I know he has asked Ms. Singh to accompany him. We will permit Ms. Singh to sit next to him, but we will not permit Ms. Singh to speak as yet. So if we could invite Dr. Patron and Ms. Singh to the front, we'd be very grateful. No, we know. I know what I'm talking about. Dr. Patron, thank you very much. And we're very grateful for this extensive witness statement you provided to us, very detailed and very extensive.
Through you, please.
Yes?
I did not receive a copy of Dr.
That
Patron's.
wasn't disseminated? He didn't send it to us. He didn't send it to us? Well, I would have received this in my mailbox. I thought it was sent. Dr. Patron, did you send your statement to the committee? Can you, are you able to send it electronically now?
Yes, I believe I can.
I'd be very grateful if you could send it to the secretary, who could immediately disseminate it.
Yeah, but the unfortunate thing is he may have to come back, because
Oh, he will have to come back.
To read it.
He will have to come back. So while you receive the very able assistance of Ms. Singh in doing so, Dr. Patron. Can I ask you to make a brief statement, and then we will go through it? I am particularly interested in drug registration, the operations of the Drug Advisory Committee, the Drug Registration Unit, and special permission. And I wish to take you through the minutes of a meeting, of 16th October 2023. Let me just make sure I get the date correct. Yes, 16th October 2024, in terms of special applications. All right, so Dr. Patron, a brief opening statement.
Well, it's my pleasure to be here, Chair. I have been the Secretary to the Drug Advisory for 8 years, starting in 2017 and ending on the 25th of November. I was reappointed again as member of the DAC, Drug Advisory Committee. A little background on drug registration in Trinidad and Tobago, many of which you all may not know of. In 2013, there was a backlog of almost 500 drugs. In 2016, the labs had closed its doors for almost 10 years. So there was no drug evaluation happening at that time. I came in 2017 with a mandate to clear the backlog and also to continue with drug registration at an unprecedented rate. The CMO at the time, which is Dr. Parasram, suggested the use of the concept of reliance. Now, reliance is a concept used by WHO that hinges on the use of approvals that have been achieved through competent authorities worldwide, that is recognized by WHO. Now, this concept has been documented, it has been recommended in minutes 224 of the Drug Advisory Committee, and the conditions therein lays the foundation for the guidelines that were suggested or published in 2021, right, onwards on the official Ministry of Health website, and continues to be the guiding force in the importation of drugs until 2025. It was changed. But during my tenure, there was a lot of problems in terms of bypassing. In 2021, the Secretary to the Drug Advisory Committee was bypassed, and this was the first instance of parallel drug registration unit.
Hold on, hang on a second. When you say that the Secretary to the Drug Advisory Committee was bypassed, for the benefit of the members, listening and viewing members of the public, what do you mean? What is the role of the Secretary?
The role of Secretary is the administrative, technical, and facilitative role. It is not legislative. It doesn't make regulations. It doesn't break legislation.
All right, let me ask you this. The Drug Advisory Committee is a statutory body established under the Food and Drugs Act. Am I correct?
Yes.
The jurisdiction of the Drug Advisory Committee is plainly set out within the Food and Drugs Act. Am I correct? Mm-hmm. The composition is set out in the Food and Drugs Act. The role of the Secretary is set out.
The Secretary is an assumed function. It's not specified per se in Section 26(1)(a).
Okay.
But
So where does the Secretary get its power from?
in fact, the Secretary has no power. That's the whole thing about it.
All right, so where does this appointment to the post of Secretary emanate from?
It emanates from the Minister, which appoints a member to the DSC. The member that is sitting on DSC that is also affiliated with CFDD becomes the Secretary.
All right, so this is a practice emanating from policy and not legislation. Am I correct?
Yes.
What at the time, what was your affiliation, what was your role in CFDD?
My role as in CFDD, I'm a Food and Drug Inspector too. Right? My function, I'm a standard regulatory officer with respect to food, drugs, cosmetics, and medical devices. That is what my purview is as a F&D inspector.
Right. So as per the prevailing policy at the time, you were appointed as Secretary.
All right. And member.
Which is a role which has no statutory basis, but which really is administrative in nature.
Right.
Okay. Continue.
So, 2026, laboratories closed. There was no...
2026?
2016, sorry.
Okay.
Laboratory closed. 2013, there was a backlog of over 500 drugs we had inherited from the past secretariat who had retired. Now, 2017, I was appointed member and secretary, right? And I was given the mandate to clear the backlog and also facilitate the drug registration process. In the absence of resources, in the absence of any laboratory that could confirm any drug, right? Now, as I said, the chairman at the time, Dr. Parasram, said that introduce the concept of reliance. Reliance is where small states or even large states can rely on the competent authorities recognized by WHO. And this is nothing new from our legislation, because our legislation, Division 3, paragraph 3, A to F, 1 to 5, also specifies SRAs. It mentions US FDA, it mentions Health Canada, it mentions UK, it mentions European Union, right? And paragraph 4 of that same division 3 also states that the minister can accept an application from anywhere in the world, may it be Timbuktu, but the applications must be in English, it must speak to quality, safety, and efficacy, and thirdly, it can't ask for any requirement under the law, or he can ask for any additional requirement. So those are the 3 criteria, section division 3, paragraph 3 and 4 of the Food and Drugs Act and regulations. So that encompasses the reasons why the concept of reliance was used without breaking or exceeding any law, because it falls within the ambit of the regulations.
All right, so whilst we're on that, the concept of reliance, let me stop you for a minute and let's segue into something which is fairly contentious. And it's topical in the society. You're a drug inspector too. You have deep experience in the pharmaceutical industry, do you not?
Yes, I would think so.
Generic drugs, there's a raging debate as to whether the country can benefit from generic drugs.
That's true. Generic drugs is really a copy of the branded drugs. But the problem we are having right at this present moment is that the generic drugs, the manufacturers are not submitting bioequivalence. Now, bioequivalence simply means that in a scientific sense, if you test versus reference the release of the active pharmaceutical product into the systemic circulation occurs at the same rate and extent of absorption.
Right. So let me ask you this.
The drug will behave the same way as the branded product.
We accept that, Dr. Patron. Would you agree with me that there are world centers which have established world-recognized excellence for the manufacture of generic drugs?
Yes.
It's Canada is a world-renowned center for the manufacture of generic drugs. You agree with me?
Yes.
You agree with me that 1 in every 4 prescriptions in Canada is a generic drugs?
Yes.
Germany is another generic drug manufacturing center which is known for its excellence. You agree with me with that?
Yes.
And the biggest generic drug manufacturing center in the world is India. As a matter of fact, a very high percentage of the prescriptions written in India is for the generic brand of the drugs, right? Dr. Patron, would you agree with me that an extremely high percentage?
Yes. In fact, our database, 1/3 of our database is from India, which is about 21,000 in our database.
Now, introducing the concept of reliance, okay? Would you say that it should be easier for generics emanating from these 3 distinguished and recognized centers of excellence to be admitted into the local market?
Definitely it would.
Fairly easily?
It would be.
All right. In your experience, have the prospective importers of generic drugs found it easy to get import permits from these centers of excellence as we have described them?
Yes, some importers, in fact, the medium and the small importers, some of them are very good in terms of getting the actual document, the CPP, the GMP, the COA, the stability,
All right,
the
so
bioequivalence studies.
Let's now get to that. The major allegation made against you, as you know, was that you in 2017 unilaterally changed the form.
The role of the Secretariat is administrative, technical.
Did you change the form, Dr. Patron, yes
No.
or no?
No, it wasn't a decision made by me.
Who made that decision?
That was the decision made at the 224th DAC committee, which minutes were supplied.
All right, so the 224th, that was a meeting held on 16th April 2020.
Yes.
2019, right? Present at that meeting were Dr. Roshan Parasram, Mr. Faz Khan, Mr. Adrian McCarthy, yourself, who you are described as the technical secretary, Dr. Saeed Rahman, Dr. Patricia Seeley, Ms. Shelley Monroe, Ms. Julia Davidson Plaza, Ms. Sunita Maraj, Ms. Winona Franklin, right? Can you point me where in the minutes the decision was made to change the form requirements?
The form requirements, as you mentioned, now the Form A and B that you're referring to, these are not scheduled forms. These were guidelines that were provided to importers over the years and was handed down to the present secretary. They are non-scheduled guidelines that were provided to importers from historically before me. My predecessor used those forms.
So hang on a second.
Those forms are not new forms.
Dr. Patron, hang on a second, would you? When were those forms first used?
Those forms were first used before even my time, 2017.
So, am I not correct? You told this committee that there was a decision at the 224th meeting to change the forms?
The guidelines, to update the guidelines.
All right, can you point me to the page?
Which page is that? Which page is that?
Is it page 3? Drugs that are not on latest versions of WHO's EML?
Yeah, that's part of the WHO reliance concept.
Right, so where is it in this meeting that the concept of reliance was adopted?
It refers to the stringent regulatory authorities. It refers to drugs without them. It refers to WHO.
Dr. Patron, I'm asking you a simple question, and I should require a simple answer. Where in these minutes does it say that the concept of reliance is taken on board?
These are the embodiments of reliance.
Dr. Patron, you told me, I asked you very simply, that the allegation made against you was that you unilaterally changed those forms without authority in 2017. You denied it fervently. And you said that this was arrived at the 224th meeting. I have the 224th meeting in my hand. I'm simply asking you to point to me the page of those minutes where that decision was made and minuted. That's all I'm asking you.
All these terms that they have used here embody the concept of reliance.
Right.
The discussion
so where did the decision to Form A and Form B come from?
The discussion involved the reliance concept, and that is manifested through the terminology that we use throughout the discussion.
Dr. Patron, my question is a simple one. Who took the decision?
The committee.
To introduce a Form A and a Form B?
That was not our decision. That decision was done previously by the previous secretariat.
You agree with me that there was absolutely no basis in law to ask importers for a Form A and a Form B?
Form A and Form B are non-scheduled forms. They are served
Dr. Patron,
as guidelines.
Dr. Patron, do you agree with me that the legal advice emanating from the ministry was that Forms A and Forms B had no basis in the Act?
Yes, they are scheduled forms within the Act, B and C. No, C and D, sorry.
C is the only form
C and D.
which is required, right?
C for new drugs and D for supplemental drugs.
Right.
And E for the receipt.
And E for the receipt.
Yeah.
So I have read the Act, Dr. Patron. Please credit me with some sense of preparation.
Yes, you're correct.
Yes, I know I am. I'm sorry to sound that way, but I have read the Act. I have also read letters from Mr. Hasmat Ali, in which he indicated that legal advice was that there was no basis in law for Form A and B. My question to you simply is this. When was the decision taken to introduce Forms A and B? By whom and on whose instructions? It's as simple as that.
That was before my time, and it was done previously by the previous
So
secretariat as a
when-
guideline to the importers.
So when Mr. Ali came and told this committee 2 weeks ago, or 3 weeks ago, as the case may be, that you unilaterally changed these forms without jurisdiction,
That is totally untrue.
that is an untruthful item of evidence that Mr. Ali was giving this committee?
That's totally untrue.
Now, this is troubling to say the least to me. I don't know about the other members of the committee. Because here you have a senior public servant coming to a parliamentary committee and telling what as chairman of the committee, I want to use parliamentary language, and I will borrow a phrase from Sir Winston Churchill, an unmitigated terminological inexactitude. That's what it is. So we don't know who's telling the truth. Just now. So,
Ask for a little clarification. Maybe I missed it.
Yes.
Thanks. Dr. Patron, what was the objective to be achieved by introducing Forms A and B?
Well, I didn't introduce them.
No,
originally.
I'm not saying that you introduced them. You said
They
you
were
met
simply-
them.
yeah.
You said you met them.
Yeah.
But
They were simply
you would have
introduced
used
as
them.
guidelines to help importers to answer questions before they actually completed the form and to produce any preparation of their dossiers. Dossiers are very complex documents. They involve administrative, chemical, pharmaceutical, and manufacturing details. Sometimes range from 80 pages to 15,000 pages. Right? These are very technical documents.
yeah, Senator Nakid?
Just 1 second. So Forms A and B,
Would assist because
to
Forms A
clarify how to go through
would
the
be
forms.
guidelines,
Right.
how you fill out or present the information. Because Division 3, Section 3A to F, it specifies the methods and certificates that are required. So it tells you, an ordinary layperson looking at the regulation would not be able to figure out what are the requirements in terms of the specifications. For instance, if you give a layperson, just show them Division 3, Section A to F, you will not be able to figure it out. You would know what is a COA, a certificate of analysis. You would not know what is a GMP,
Okay.
good manufacturing practices. You would not know what is a CPP. You would not know what is required.
So
it was meant by previous secretaries to clarify the information that's provided in your dossier. Because as I said, dossier is a very complex document that lay people who believe that they can do it just like that find themselves in a serious problem because they don't know what is expected of them.
Okay.
I
So it
said
would
in the
help
beginning-
small importers?
Small importers,
Okay, thank you.
yeah.
Didn't hear that last point.
Ask if it would help the small
Very much so.
importers.
Very,
Forms
not
A
only
and-
small importers, everyone.
Okay, thank you.
That's
very
why
much.
it was passed on throughout
Over a
procedurally
period
and
of
historically.
time to help with the procedure.
Right, yeah.
Thank you.
Dr. Patron, what you're saying is highly contradictory based on what was said in the last meeting. As a matter of fact, it was said by the member, the person who sat there, that this form was introduced in order to make it extremely prohibitive. Let me finish. Extremely prohibitive to smaller importers to get through. That's what you are saying now. No, that helps the
Helps.
smaller importers.
In fact, that helps and the small and medium-sized importers to understand the process and to understand what is required to complete the dossiers. As I
So
said,
if you are saying that there were pages sometimes 800 to 1,500 pages.
Yeah,
You're saying
15,000.
that would help a small importer?
It will tell them what certificates are required. It will tell you if you need a certificate of free sale, if you need a certificate of analysis, a GMP certificate.
I am going to, there are a few things I want to discuss with you, Dr. Patron, because there's something in this thing that is troubling to me. All right? I have in my hand here a letter provided by the Ministry of Health, CFDD. And it is from the Chief Chemist and Director of Food and Drugs acting to the Permanent Secretary. It's dated 30th December 2025. The subject is reversion to the requirements for the registration of a new drug pre-2017 and associated submission checklist Form A. The above subject in caption refers, pursuant to the Food and Drugs Act, Chapter 3001, and the Food and Drugs Regulations made thereunder, the registration of a new drug is required to be conducted in accordance with approved statutory requirements, established procedures, and duly authorized administrative instruments. Following a review and search of the relevant records, no documentary evidence was identified demonstrating the required approval to amend the requirements for the registration of a new drug and the accompanying submission checklist Form A. In particular, no approved authorization documents nor copies of the Drug Advisory Committee minutes of the Drug Advisory Committee recommending or endorsing changes to the registration requirements prior to 2017 were located. How do you explain that in the context of the evidence which you gave that Forms A and B were historical forms which were inherited by the DAC?
It was inherited by the DAC because it existed before my time. What had happened
Dr. Patron, if we had to search the ministry's records, would we find Forms A and Forms B prior to your time?
Yes, they would.
Prior to 2017?
Yes, they would.
And you're absolutely sure of that?
Yes.
So this is what the letter goes on to say. In the absence of documented approval of formal DAC recommendations supporting the amendments introduced after this period, a determination has been made to revert to the version of Form A and the associated requirements that were in use prior to 2017. But what you are telling this committee is that these requirements always existed.
Yeah.
So why is the ministry reverting to pre-2017 requirements when you say that that always existed?
They were existent. These are guidelines that were existent. They were non-scheduled forms, A and B, but they were introduced not by myself, but early on before me. But what had happened because of the backlog and because of the laboratories had closed in 2016, right? The mandate was to take the drug registration process forward. And the only way to do that was to use concept of reliance by updating the guidelines, not changing the law, using Division 3, Paragraph 4 of the regulations.
Let's see Division 3, Paragraph 4.
It simply says the minister can accept an application from anywhere. Once it is in English, it speaks to quality, safety, and efficacy.
All right, so this is what Paragraph 4, Division 3 says. And I'm not entirely sure that I agree with your interpretation of it. I don't think it's as wide as that. The minister may, in his discretion, accept a new drug submission that contains information specified in paragraph 3, A to F, and that includes detailed reports of the tests made to establish the safety of the new drug for the purpose, and under the conditions of use for which it is recommended, and B, such other information and material as the minister may in particular case require. Right? So the base requirements are that you submit a Form C satisfying A to F. But in 2017,
Also,
hold on, 2017, there were many, many changes introduced, and I'm going to go through them with you a little bit. But I still want to go back to this letter that I was reading from. There's another letter that accompanies it, you see, another part of it. So on 15 January, the chief chemist writes to Food and Drug Inspector 3. Who might that be?
as Mr. Wayne Watts.
Right. And this is what he says. Based on, and that is your superior officer?
Yes, he's,
Based on legal advice received from the legal advisor regarding the legitimacy of the use of Form A in the application process for new drugs, it has been confirmed that the completion of Form A is not a requirement under the current statutory process as outlined in the Food and Drug Act. My question to you is this. When you assumed your role in 2017, didn't you see it fit to seek some sort of legal guidance before imposing Form A and Form B on the importing public?
as I said, my role is basically...
I didn't ask you that. I simply asked you whether or not you didn't see it fit to seek recourse to legal advice before imposing these requirements on the importing public. The answer to that is either yes or no. Because here it is, you have evidence in which the ministry advising itself now is saying that these requirements are plainly illegal. Ultra vires the act. What I want to know is when you took office in 2017, did you do this on your own?
We could direct it to do that.
By whom?
By the present director, the CMO.
No, hold on, let's get the names. The present director, which present director?
Mr. Khan, Faz Khan.
Faz Khan directed you to do it.
Roshan Parasram is the CMO.
Right, who else?
The PS, Asif Ali was the...
Asif Ali.
I believe was the...
And who else?
The then minister, I don't...
Sorry?
Up the chain, everyone else.
No, don't call the minister's name if you can't verify that. I'm not going to tolerate that. Unless you're willing to say that you were given direct instructions for that, I'm not tolerating that. So your evidence now is that you were directed to change those forms. So what happened to the evidence you gave us earlier that those forms are always in use? What has become of that evidence? Are you abandoning that position now? Dr. Patron, we want the facts.
The facts are, these forms existed before my tenure.
So, all right, okay. Let's take that there. Why did you just tell the committee that you were directed to change the forms?
But at the meeting of 2/24.
All right, so let's go back to that meeting. We're going to spin a little top in mud here, but we're going to go back to that meeting. Point me to the page where you were directed. I've read it, Dr. Patron, it's not there. No such decision was taken at that meeting.
It mentioned the SRA authorities, it
Mentions all of that.
the list of the emergency medical
All right.
listings. It mentioned the
Dr. Patron.
stringent regulatory authorities.
All
These
right.
are all concepts that we used in Reliance.
Right. So that was 2017? That meeting, 224?
No, that was in 2019. 2019.
So, okay, Reliance came into being in 2019, right?
Yeah.
The expressions of Reliance.
Yeah.
So why was the form changed in 2017?
It wasn't changed in 2017.
It wasn't. So the first change was 2019?
It was mentioned in 2019, but the change actually was affected by FASCAN, published on the website in 2021, and thereafter was updated periodically.
Oh, so, all right, let's get the sequence of this right? Nobody is challenging you, we just want to get to the truth. So, Dr. Patron, you take this job in 2017. A Form A discussion is had in 2019 on the concept of reliance. In 2021, two Forms A and B, which seeks to give effect to the concept of reliance, was introduced by Mr. Faz-Khan. What was his role in the ministry at the time?
He was the director. He was the director at the time.
Director of who? Food and Drugs?
Food and Drugs, yes.
And those forms introduced additional requirement to the 2017 regime. Okay? Am I correct?
Yes, introduced the concept of reliance, yes.
So I'm going to go through some of the changes because I have a form in my hand. And some of the changes which have no statutory bearing, no requirement under Form C. Is this drug being sold in the country of origin? That's a question asked. That has it has no expression, right? We're going to go through this fairly quickly. Has this drug been withdrawn in any country or district? Is this drug the same drug approved by the reference authority? Has any change been made? Have those changes been approved? And this is where we get to the part where the policy becomes very restrictive. Certificate of analysis, each excipient original. You see that there? Then you have a GMP certificate, raw materials. What does that mean?
Our certificate of analysis, the drug registration is hinged on registration final pharmaceutical product or form, meaning the final pharmaceutical product, it constitutes the API and also the excipients. No, the excipients is the other ingredient besides the active ingredient. It could be colorant, it could be the stabilizers, it could be the whatever else besides the active ingredient. Now, what has been found is that in the past, because of the absence of the labs in 2016, there was closure of the labs in 2016. For 10 years, there was no evaluation by the laboratories. So it was felt by the public, by the committee, in the sake of public health safety, that excipients, which constitute part of the actual component of the drug, also require analysis, because our labs could not do it. And the ministry was not outsourcing for laboratories. So it was felt as a matter of public health safety that products would now have to ensure that their raw materials are safe and they do not have heavy metals to kill people.
So each excipient, you have to have a certificate of analysis for it?
It ensures the product identity
I didn't ask you
and purity.
I did not ask you what it was for. I simply asked you whether or not each excipient required a separate certificate of analysis. That's all I'm asking.
You can do it on one certificate or you can do it on several certificates.
And then raw materials. What's the meaning of that?
Raw materials, as the name suggests, is raw. These are materials that are unprocessed. Unprocessed. They're raw materials.
How does unprocessed material end up in a pharmaceutical?
Well, you have maybe the raw products, the products that are not processed as yet. The APIs, the source of the materials, if it's chemical or what, that is referred to as raw, the unprocessed.
You have to have a GMP certificate, a good manufacturing practice certificate for raw materials. And you're telling me that raw materials are unprocessed items?
Yeah, unprocessed, yeah. Or
So-
manufactured in laboratory but not yet sterile, or not yet purified.
I must confess, I have some kind of difficulty in following you there, but perhaps it's my fault. So let's move on a little bit, right? The other requirements introduced are adverse event reports, a risk management plan,
No,
periodic safety update records, pharmacovigilance plan, post-marketing surveillance plan. And all these were introduced in 2021, right? So I'm going to stop, just stick a pin for a moment, as they say, Dr. Patron. I see Mr. Maharaj waving his hand frantically in the back to get my attention, to perhaps say something. Mr. Maharaj, can I ask you to come and sit in front so that you can address the committee properly? Mr. Maharaj, I saw you waving your hand, and you seem to want to say something on this drug registration.
Thank you very much, Chairman, and thank you to the panel. I've been in this business of registering drugs since 2015. And just to reiterate what Dr. Patron has been saying, this Form A has been around for quite a while. And I can't understand it. The issue that I had was when I started to re-register products in 2022, and I saw these new requirements. Based on that, I asked the CMO at the time, who I know is the chairman of the Food and Drug Committee, to have a meeting. The meeting took place around the 22nd of October 2024. And it was about the same thing, about these, excessive requirements and so on that we had to use, especially with simple products like the vitamins and everything like that. And we found it, not only me, but a number of importers found it very difficult to provide these materials, especially where vitamins were concerned. So that was one of
And these were vitamins which were being sold?
Manufactured in the US, sir.
And sold across stores in the United States?
Correct.
And yet you were being denied permission to import these items?
Well, denied is probably the wrong word, but to get all these excessive requirements and so on.
But this was under the tenure of Dr. Patron. Didn't you all make representations to Dr. Patron to tell him the onerous and untenable nature of these requirements?
Not to Mr. Patron, because when the CMO wrote me back, he directed me to meet with the director at that time, which was Mr. Khan, along with Ms. Siboo.
And what did those two people tell you? Those two public officers tell you?
Well, they told me basically, we would have had follow-up meetings, and then we started to do it through the Pharmacy Retail Association, and we made some recommendations and so on. But some of the stringent requirements are still there, But at those meetings, it was just myself. It was one meeting we had just with Ms. Siboo and with Mr. Khan.
And nothing came out of it? So no requirements have been changed?
Not to my knowledge.
So even though the ministry has reverted to Form C and purporting to keep within the I should say, the virus of the statutory regime, nothing has changed?
Well, the requirements, the same requirements that you talk about, like the GMP for raw materials and so on, I think they have actually taken that out. But there is still a lot of stringent requirements, like, to get the container with the ink and all of these things, what type of ink is using for the containers and so on, especially with vitamins.
No, hold on. When you say the ink on the inside of the container, ink on the outside?
Well, that sometimes is a little bit blurry in terms of that. If you look at, I think you have a copy of the requirement in front of you, and you'll see
I do.
At the back pages of for me what they ask for.
No. You all are the importers, and you have to. So let me ask you this.
Yes, sir.
So when you have to submit ink, one would think that a requirement for an ink analysis would be where the name is etched on the tablet itself.
So what happened is that I will get a letter confirming that, the whole safety guidelines and everything like that would have been followed, So that is what I'll get
And then
from
you
the
get an
manufacturer.
inquiry that you don't have an ink analysis? And does the ministry identify what is the shortcoming or the shortfall?
No.
in the ink?
In terms of that, yes. They don't ask you if you get a confirmation letter from your manufacturer indicating that all safety guidelines have been followed, then they will let it through.
Yes.
I heard about Reliance stuff from the US and the UK and Canada, EU, etc. So I assume that if you say, look, these drugs have been used in the US and UK, EU, etc., it would have met the standards because they have very stringent requirements.
Correct.
So it seems to me these forms A and B is a sort of arbitrary imposition.
Well, yes, that's what I'm getting at. I want to know, we have two bits of evidence which are diametrically opposed to each other. We have the evidence of Mr. Ali, who says it was Dr. Patron who changed those forms unilaterally and without authorization in 2017. And then we have Dr. Patron who's come here and said, well, I met those forms there. Those were always in existence. So the evidence, it appears to me, to be diametrically opposed to each other. How do we resolve that? I see Mr. Suchit, and I want to give him 5 minutes to.
Thank you, Mr. Chair. To all the panels here, much appreciated. If I get 5 minutes, that is plenty, but I don't plan to take so long.
But don't
just to clarify,
take all 5.
Yeah, just to clarify, the general perception coming out here is something that the Private Pharmacy Retail Association brought to light a number of years ago under Minister D.L. Singh. The forms that have been presented, Dr. Patron has indicated historically, my assumption, these things were there for a general guideline as to what is required for overall registration of drugs. Now remember, drugs fall, into different categories. We have over-the-counter, we have narcotic control, antibiotics, all of which will have more stringent requirements depending on the nature of the drugs. The country of origin is one concern because coming from a SRA or a stringent regulatory authority can be used as a guideline for importations. If something is coming from America, our perception is you shouldn't have to provide, 2 samples of the product, proper labels, basic GMP certificates for the product, the certificate of analysis, a certificate of free sale from the country of origin. But when you start to get introduction of requirements, as you're seeing now, from 2021-22, indicating that you have to get the food coloring used in the manufacture of the tablet or the color of the label or the ink, they start to make it difficult in our perception to get registration. And when we look also at some of the companies that are getting registration with these same stringent requirements, which small and medium companies are not able to provide, it makes you wonder if there's a disparity and this is being used as a tool to stymie the approvals for certain companies and not certain companies. Thank you, Mr. Chair.
It's what is known in commercial language as regulatory capture.
Thank you.
It's a well-known phenomenon in developed markets, where companies affect policy change, knowing fully well that it would in effect result in regulatory capture. So I want to go on Dr. Patron a little bit because I'm a little troubled by the fact that we have diametrically opposed evidence. So I was reading from the letter of 15 January 2026, in which the chief chemist was saying that Form A is not a requirement. Okay? And I'm still deeply troubled by how this Form A and B came into existence. And nobody can adequately or properly or reasonably explain that to me. I'm seeing Mr. Ali's hand in the air. Imtiaz Haider Ali for the public record.
Yes, Chair. I was part of the drug registration unit as early as 2008 under Mr. Ramcharan, and subsequently after that under Ms. Stella Harrigan. In 2009, Ms. Harrigan started discussions of a checklist, internal checklist. And that's what was used in the development of internal checklist. Up to 2017, it was only an internal checklist and it was named Form A or Form B.
So how did it come into Form A and Form B to be a requirement outside the terms of the statutory regime?
And that was changed after.
Who made that decision?
As far as I'm concerned, when Mr. Patron took over, it became Form A and Form B.
No. You're not going to cast aspersions on people without some evidential foundation. Okay? That is speculation on your part, unless you can tell me that you have evidence that Dr. Patron himself conjured up these forms and took it up on himself to print these forms, because these forms, I have a copy of these forms here, okay? Took the time to obtain a copy of the form. These forms are printed with an official government, with the coat of arms. Who gives the printry the instructions to print official government forms with a coat of arms? Where does that come from? This is not printed on a computer. This is printed with the government coat of arms of the Republic of Trinidad and Tobago. And no public servant at the level of Mr. Patron can go to the government printry and give instructions to print those forms. I'm not buying that story. I'm sorry to tell you. Peremptorily, I'm not buying that story. That approval for those two forms had to have come on an official communication to the government printry. And in 2021, we were still printing things in the government printry. Who gave that instruction? No public servant at the level of Ms. Dr. Patron could have walked down to the printry and given those instructions. That's factually untenable. You were there. Somebody must know who did this. And there's a deafening silence from all the public servants who were present when this happened. And no one can tell the committee who gave those instructions. Because these forms achieved what I would describe as regulatory capture. Senator Nakid?
Mr. Imtiaz, just be clear. Instead of saying Dr. Patron is the one, was there a meeting convened? At that meeting, the decision was taken or you heard from high up, or it was said in the minutes that the decision will be to adopt Form A and Form B?
No, what I'm saying is, when Dr. Patron became the Secretary of DEC, the form that came out afterwards circling into the public was different. It was now, instead of a checklist, become a Form A and a Form B.
So we're trying to find out that you said after you came in, that form came out differently.
Yes.
Were you present when that decision was
No,
taken?
I was not in drugs anymore after that.
Would Dr. Patron have been present? He would have been present at that
Yeah,
meeting,
he would
of
have
course.
been aware.
But Dr. Patron, at that meeting, was it then determined that that decision would be taken?
Everything was approved by the director. It was published on the Ministry of Health website, www.health.gov.tt, up to 2021. Going forward, that set directions, instructions were updated periodically, and the director was the one who was in charge.
Okay, so now we're getting somewhere. So it was published on the Ministry of Health website.
Since 2021.
Who gives that
Director.
Pardon?
The director gives that
The
instruction.
director.
Senator Lackett, can you just, one, if I could interpose, in what form the director gives that instruction?
He instructs the...
How? How?
Through email, the IT person to develop an online form and instructs the IT person to publish it.
So that email must exist somewhere.
I believe you have that copy.
And how were you told of it?
How? It would present itself on the website. So if you go on the website...
No, hang on. Let's take this systematically. You are the technical secretary of the Drug Advisory Committee. The director makes a decision. He instructs the IT people to develop the form. How were you told that this is the form that is going to be used?
Through email, he asked me.
All right.
To look at it too.
So where in your email, you would have those emails?
Yes.
Would you not?
Yes, you have it as well.
Where? Which email did you produce where the director told you? I'd be very grateful if you could point it out to me. Because that's a question that I'm very interested in. No. Because I have seen email from you passing back and forth where you are complaining of being bypassed, and we'll get to the bypass just now.
Okay. Now this letter. This is from Mr. Khan on March 21st, 2025.
2000 and when?
25, sending out the set guidelines.
Yeah, but hang on.
Form.
This is 6 years after we're talking about. March 2025. This is 6 years after this form was being used.
2023, 2024.
Can you tell us what page you're looking at?
What page is this? Appendix 8. You look at Appendix 8. You will see all the emails going back and forth from IT to Mr. Khan to IT. And he himself sending out the said forms from 2021 onwards until he retired, until he exited.
All right, so let's say then that the short answer to the inquiries we've been making will be better answered by Mr. Khan,
yes,
who you say is the one who developed these forms. Okay? Now, there's something that's troubling me a bit, because I read some of these minutes, and it prompted me to make further inquiries. And this has to do with special registration. Okay? Because here we are, the ordinary importer wishing to import a new drug has to, as you all have described it, jump through hoops to get a new drug passed, right? So we then have a meeting of the Drug Advisory Committee which takes place on Wednesday, 16th October 2024. You were absent from that meeting, but it's annexed to your witness statement. Okay? It's the 243rd meeting of the Drug Advisory Committee, and this is a procedure that's troubling to me. Are you familiar with the concept of special permission procedure?
Special permission is not given by me. I don't have the authority to.
We know
to make
that. Is there any basis in law for the minister to grant special permission for the importation of any pharmaceutical, which has not been previously registered?
There's no provision in law.
So why would the minister, where's the letter from the Ministry of Health? On what basis would, between the period January 2020 to May 2025, issue 1,898 special permission importation? Why? This was in specific answer to a question the committee asked. And we asked whether only one special permission was granted during the period January 2020 to May 2025. The ministry's official response to the committee is no. The number of special permission submissions which were granted during the period January 2020 to May 2025 was 1,898 special permissions in 5 years. And there are other ways we're going to drill down into this, but I want to go through this minute of this meeting with you, because the issue of special permission was raised here. And it's at, do you have the minute in front of you, Dr. Patron? So the issues discussed was new drug submissions. Okay? And you can see that 14 new drug submissions were presented by Mr. Khan in the order on the listing with the comments below, and there were comments. Then we skip over 2 pages, and we come to what I consider something to be quite troubling to me. At 1.3 in the minutes, it says special permission submissions. And the DAC is being advised by Dr. Rahman. Dr. Rahman stated that the law does not have anything written for special permission. However, sometimes there is need for a drug on short notice. For example, in the case of an outbreak, special permission is granted under those circumstances. You see that? Mr. Khan explained there may be issues with the supply chain. Now in 2024, 16th of October 2025, we know that there was no outbreak. We know that there was no supply chain issues, because there's a date, a cutoff date that it's important that I'm coming to. Mr. Khan explained there may be issues with the supply chain. Consideration is given by the CMO to issue approval for public and private sector. Basic documents are required as well as labeling. CMO intends to eliminate this. Mr. Khan went on to explain that applications were requested from companies who receive special permission to be reviewed by the DAC in terms of recommending to the minister for approval, or if further documents are needed for the registration process. Dr. Ramnarayan asked what was the reason for applying for special permission and if that information will be provided. Mr. Khan replied that requests are from oncologists and there is a need for the drugs. Dr. Rahman added that consideration is given if there is no alternative drug However, once special permission is granted, it tends to be continuous instead of proceeding with registration. Now, this is what is said in the DAC. The committee, acting through its secretary, asked about that. And it said, the question we asked is whether special permission authorizations have expiration dates. And the answer was yes. Special permission authorizations expires upon the arrival of each individual shipment. That is not what the Drug Advisory Committee seemed to be saying here. Would you agree with me? Dr. Patron? Would you agree with me?
Yes.
That once special permission is granted, the Drug Advisory Committee seemed to be of the view that there were no further requirements for registration and the drugs could be imported continuously.
Yes.
You agree with me?
So it seems.
Sorry?
So it seems.
Right, and this is particularly important when we get to the list that was provided to the Drug Advisory Committee afterwards. He also inquired if anyone signs a document to accept liability. Mr. Khan replied that it is signed off by the CMO, but there is no disclaimer. He also said that special permission is to come to an end by October 31st, so there's urgency to move forward with the process since after that date, special permission may not be granted. What was the magic of October 31st, 15 days away? What magical event was happening on October 31st, 2024, so as to take away the special permission jurisdiction? That the committee had to be rushed, and it's important because we're going to get to the important part of it just now. I want to know what significant event was slated to take place on October 31st? Plainly, you do not know, Dr. Patron. So the date of October 31st was thrown to the committee to hustle the committee into making a decision. Doesn't it appear so to you?
Yes.
And then there is a discussion. But you know what's troubling? After that, let's go to the paragraphs before the table is presented. 157 special permission submissions were presented by Mr. Khan in the order on the listing. So when you go to the table, there are pages and pages and pages, exactly 5 pages, where every drug which was granted special permission, you know what the notation is? Missing information has to be confirmed. Missing information to be confirmed. So you have, despite all the platitudes espoused here about public safety, a permission being granted for the importation of 157 pharmaceuticals on the special permission regime with missing information. How do you explain that? How, from a public safety perspective, do you explain that? And then, as my grandmother used to say, the cat high and done there yet, you know. Pandit Professor is generously grinning, but the cat high and done there yet, because I have, through my very efficient secretary and Assistant Secretary, Ms. Peterkin, a list of all the special permissions granted. How does that happen from a public safety perspective? Dr. Patron, you care to explain that to me?
Mr. Chairman, just before Dr. Patron explains, for those of us who may only know English, what is Qatar?
Means story.
Thank you.
It's one version of the word story. The other version is Leela.
Okay. Thank you very much.
Happy to have enlightened you somewhat. Would you care to explain that to me?
Mr. Chair, I wasn't present at that meeting, and Mr. Khan is the best person to explain.
What I want to know is what's the legal basis for special permission. I have the legal office of a Ministry of Health here. Madam, Mrs. It's Kowlessar, I know your maiden name to be. Ms.
Yes.
Kowlessar-Tagallie. It's Tagallie?
Yes.
Mrs. Tagallie. What is the basis in law? I want a specific provision in the Food and Drugs Act, because this is a statutory regime. What is the provision in law which allows a special permission license?
Chairman, there's no provision in the legislation that allows for the grant of special permission.
So between the period, all these drugs, and we have it here, okay? Let's hold it up for some dramatic effect a bit. I'm going to confess that I'm shamelessly holding this up for dramatic effect. You see all of this? With 3 appendices, all these are special permission. Senator Nakid?
Chairman, all right, so I want to encapsulate this thing because we're getting technical, and I want to, as a fellow from the corridor, all I know is right and wrong. So we've established that the special permissions are not in legislation. Basically, that means it's against the law. So somebody broke the law 1,800 times, Chairman?
198.
1,800. Somebody broke the law 1,898 times. So then the public would like to know, who has the mandate or the authority to possibly pursue a special permission regulation? Yeah.
Mr. Chairman, if you'll allow me, I'm just putting on my hat here as a former public servant and former regional pharmacy manager. Okay, so
First of all, are you aware who has the power to grant a special license?
I had an incident like that I want to just kind of recall. And it was actually granted through the office of the CMO, right? So let's just say that you have a particular drug that is needed for emergency purposes that is not available, but you have identified where the source it's coming from and so on. The consultant or the doctor that works within the framework of the Ministry of Health will issue a justification letter, and based on that, it would be provided to the CMO. And then based on that.
So that's for personal use.
Yes, yes, yeah.
Right,
well,
and that's
for the
where
public.
individuals apply. Hang on a minute, Mr. Suchit. I want to clarify this a bit. So that's where individual applies, right?
Well, in some cases, like if you have, like, okay, so from my recollection, it had happened during the course when there were, where the ministry were planning
So,
a
all right,
open
let me
heart
ask you a
surgery.
very pointed question.
Sure.
Would special permission apply for trade purposes?
No.
Mr. Suchit?
Mr. Chair, there are instances, as Ms. Kowlessar rightly pointed out, it is not in law, but we cannot apply law when health is concerned. There are many instances in oncology, cardiology, where rightfully, legitimately, a patient made a doctor meeting, and the CMO has been approved.
Right,
But
so
this has also provided a loophole for the trade.
I accept that, and that's why I asked the question whether it is appropriate for special permission to be granted for trade.
Well, what would be a good indicator is the individual products, because we have had situations here
No,
where
Mr.
companies are
Suchit,
selling.
I disagree with you. because the ministry kept meticulous records. And in this document, which the ministry very helpfully provided to the committee through its secretariat, is that there is a column on the table which says the purpose. It says either personal, individual, government, or trade.
Well,
and column after column after column says trade.
that is what I am pointing out, and that is what is very disturbing, because there are products and companies right now that are not registered being brought in through special import permits and offered only trade. Thank you, sir.
Yeah, and that's what's disturbing to me. I could very well understand an oncologist having a drug that he needs for a patient to save the patient's life, applies for it. And it's a one-off, so it expires. I accept that. But how do you get an ultra-virus permit issued 1,900 times, basically? 1,898 times, Minister John? For trade purposes? And I am not going to shy away from this, But there's companies' names that just keep coming up over and over for this special purpose license, special permit license. And the documents are here to be examined if anyone wants. Smith Robertson, Bride and Pie, A. Lucky's, Vernon Technologies. Okay? Now, in Appendix 3, we asked about license granted. In Appendix 2, sorry, about the actual license that were granted.
Chairman, could I just ask before you move on, is it that we're moving on from special permission?
No.
Okay.
We're on special permission. And it's page after page after page of Smith Robertson and Company Limited being granted special permission for trade purposes. Now, the shocking thing about this is whether or not all these special permissions were lacking in documentation, as we see from the 157 in meeting number 2224. Let me get the meeting corrector. Meeting number 243 of 16th October 2024, 157 special permissions, at least 90% of which the documents were inadequate or missing. So of this 1,898 that were issued during this period, one wonders how much documents were missing. And one wonders whether there was even a move to registration, because what the ministry is telling us and what is said at the Drug Advisory Committee is totally different. Dr. Patron, can you shed any light on that?
None, I wasn't there. I was bypassed at that particular meeting.
Well, let me ask you this. Were you present at any Drug Advisory Committee meeting in which special permission applications were brought before the committee?
I don't think so. That particular meeting, I was not. I was, in fact, on sick leave, I believe.
I don't know whether any other member of the committee wishes to ask a question. Mrs. Robinson-Regis?
Thank you, Mr. Chairman. Mr. Suchit, can you say, from your knowledge, if special permissions is a new phenomenon?
Special import permits would not be a new phenomenon historically in the Ministry of Health. Moving backwards, coming forwards, there have always been challenges in sourcing medication that would be of important use and need for the benefit of private and possibly public procurement. So yes, you would have had special permits being granted for emergency or critical things that are not available and legitimately and rightfully granted. But what we have to be careful of is the escalation of this into using this loophole and opportunity to end up in companies' warehouse, unregistered, and being sold on the trade. And that is really the problem, as the chair has brought to our attention.
You're telling this committee that it is not new, but it became an escalation, you're saying?
No,
that it was
is not new. It has been going
practice.
on. Sorry, Ms. Robinson-Regis. It is not new. It has been going on, and it has been going on in many instances for the right reasons and for the right purposes. But it has been gradually escalating to the point where it being misused and used as an opportunity and a loophole by professionals and companies in this country for the importation of products that bypassing the registration process legitimately. Simply putting it.
How or when would you be able to say? Would you be able to say it was misused? Can you say?
Well, currently in the country we have a lot of products that, like Trulicity, Wegovy, or Ozempic, that registrations are in, they're missing documents, not registered, but it's available for sale.
I don't think...
Came in through special permissions?
No, not through special permissions.
No,
Sorry, yes. In instances, yes. Ozempic is one of the products, to the best of my knowledge, I don't want to be held to ransom on that, to the best of my knowledge, it is one of the products that are being brought in on special import permits. The question is if the patients are really legitimate or if they're going to the trade or ending up in spas and boutiques. We don't know.
Mr. Suchit, my short question to you is this. In your vast experience, is special permission suitable for trade purposes?
No, sir, it isn't.
Thank you. Minister John?
I felt what Mr. Suchit just said is scary. Is it then, because if it is, you all know, that they are missing documents, is it this special permission? Is there a protocol where there's a threshold, say after 4 times, 5 times, then it must migrate into real permission, actual legal permission?
If a product is not registered and all the requirements of the Chemistry, Food and Drug Department is met, and it goes before the Drug Advisory Committee, yes, initially it will be on a special import permit. Eventually, upon registration, it can be registered and bought in for trade, private or public.
All right, let me ask you this. So let's, Panadine.
Yes, sir.
How is Panadine end up on a special permission list?
Panadine, because of the codeine content, can be considered, not can be, it is a narcotic preparation. The threshold to be sold freely must be under 16 milligrams per tablet.
So how does it end up on a special permission where you bypass documentation? That's my question.
Well, to the best of my knowledge, Panadine is a registered product legitimately, so that should not be on a special import unless it is Panadine F or some other Panadine product. Ms. Siboo might be better able to answer.
Let me ask you this. Redoxon on a special permit?
No, sir.
Penicillin?
You're tickling my throat now.
Maybe you're tickling throat.
Trulicity for trade?
Thank you. That is one of the products we have
No, hold on. We're going more. Bengay vanishing cream on a special permission?
Well, that is
you
not
see, the problem with all of this, Mr. Suchit, is the special permission, this illegal and unlawful and ultra-virus special permission procedure is plainly being abused to bypass and circumvent the own strictures which were illegally created.
I'm in agreement, Chair.
Wouldn't you agree with me?
Yes, sir.
So what you have is that the creation of an ultra-virus regulatory framework which created a Form A and Form B which had no basis in law. and created such a stringent requirement that people could not qualify. But then on the other hand, you had 1,898 special permissions being granted where the documentation wasn't sufficient. So you see what is happening there.
Yeah.
You create an untenable regulatory framework, but a backdoor to walk through it without complying. That's what's happening here, Minister Nakid.
Exactly, Chair. So this was a way to bypass the process. The question is, who stood to benefit from this? That is the question. Here we have accountability. We want some chance. Who stood to benefit?
Senator Nakid, let me pass this to you and go through it and look at the companies' names that repeatedly appear.
I hope it's not the usual suspects.
It's all there.
That's something that the rest of us have.
Yeah, yes, you do.
Documents. Why you do have it?
I don't know why. You must be luckier than me. All right. Just a cursory glance at things. The same name seems to be popping up because we were asked earlier, a member said that, you know, is it because these big companies, they have more supply in the market, and therefore we need to pay them before we prioritize their payment and so. But when we see this here, that processes were bypassed in favor of these, all of this is pointing glaringly towards a kind of monopolization of the pharmaceutical market. Am I correct in that estimation?
Mr. Nakid, that was our initial concern, monopoly dominance in the market, yes.
It is regulatory avoidance resulting in regulatory capture.
Agreed.
Thank you very much.
Chair, this is very troubling.
It's extremely troubling.
This monopoly.
Can I
you understand?
impose on you for my documents back?
What's that?
You didn't go through it.
I did.
Well, I mean, Senator Nakid, look, it's the usual companies that we've been talking about. Smith Robertson, Bryden Pie, it's the usual companies. And in fairness, the column, it says trade. From what the experienced players in the market have explained here, special permission ought never to be granted for trade. So I am somewhat flabbergasted, quite frankly, that so many special permission, and in one meeting of the DAC, 157 special permissions were granted with missing documents. Yes, of course.
I just heard you say that the special permission should not be used for trade. I note from the information provided by the Ministry of Health, it says there are 3 specific circumstances that would trigger the special permit process. One being unavailability of drugs from registered manufacturer. I just want to clarify, through you, Chairman, is that for trade or not for trade? Or that use unavailability of drugs from registered manufacturer?
I would imagine that if the registered manufacturer in Trinidad, now I myself don't know what this term means, registered manufacturer, in the context of Trinidad, because we don't have registered manufacturers here. So it must mean registered importer, but there's no such creature as a registered importer either.
But perhaps I want to say, we could get clarity.
I think Mrs. Siboo wishes to explain something to us.
Afternoon, thank you very much. So just to bring a little bit of clarity to what we're discussing here, with respect to, first to begin, on Appendix 2, Chair, you would see the entire list may have just about 5 local importers. And that list will answer Part 2, Roman numeral 3, sorry. It is as a result of the Minister of Health having authority to import narcotics only. So hence the reason there would only be 5 authorized distributors for narcotics in the country, because narcotics are regulated internationally. So that's the reason for that. With respect to answering Senator Bates' question, A, on availability of drugs from the registered manufacturer, drugs are registered based on the manufacturing site. So therefore, if the manufacturer is, let's just say, GmbH Germany, coming out of Germany, and for some reason, because of logistical supply chain issues, we are unable to get it from Germany, but we can get it from Canada, then and only then, because of a need for it in the country, then and only then we'll be able to consider the permission being granted. And the permission is granted on the fact that this importer can supply the CPP, which is the Certificate of Pharmaceutical Product, as well as the GMP. And the CPP can come from a stringent regulatory authority. So if you have the GMP for the exact product, the exact description coming from the manufacturing site in Canada, and it is approved by Health Canada, then the permission can be considered for importation based on the need in the country. With respect to trade, as opposed to government products, we would have tried, the ministry would have tried to force the importers to start registering their products so that they can remain within the ambit of the law. And hence the reason we're trying as much as possible, and I can say this, to force them, so to speak, into doing what is the correct thing. But at the end of the day, we have to look at the patient and what the patient requires. Because granted, not everybody comes to the public sector. We have patients who go to the private sector. And therefore, if it is not available, and Mr. Suchet and Mr. Anil might be able to bear me out on this, you come to a drugstore, the patients are accustomed getting this, and it is not available. Where do we go from there? But we have to make sure that the documents, the product that's coming in the absence of testing, we have to verify and certify that the documents are valid, meaning that they come from a stringent regulatory authority. And in some instances, sir, they have to be apostilled or verified.
I entirely agree with you, Mrs. Siboo. You will meet little or no resistance from me on that general principle. Where you will meet a lot of resistance from me is how come all these 157 drugs were approved at a meeting of the DAC with no documents.
Approved at the DAC without documents?
Special permission was granted for missing document to be supplied.
But permission was granted at, sorry, not permission granted, it was approved for registration at the DAC?
No, for
because the
special permission.
Okay.
Only special permission was granted and there were no documents.
Well, Chair, just to be clear, I see missing information. It doesn't confirm that all documents are.
Missing
information. We're not sure what the information is missing.
Right, and if we're going to have a level commercial playing field,
yes.
If you're going to permit persons to import by way of special permit with missing documents, why not apply it across the board? And that's my trouble with this, but we're not going to answer that because it's 4 o'clock. I'm mindful of my public servants who have far distances to travel and who continue to provide human service to this committee. So at this stage, we are going to close.
Mr. Chairman, could we just get some information in relation to that prior to closing? I'm sure the public servants wouldn't mind spending about 5 more minutes.
Well, I'm not entirely sure that any one of us have the authority to speak on behalf of the public servants, but 5 minutes, I suppose it's not.
I must say that the public servants of the parliament are always...
You will find no resistance from me on that.
Extremely good public servants, and I'm sure they wouldn't mind staying 5 more minutes.
So
that leaves us hanging, so maybe we could get some clarity there.
Sorry, thank you very much. So, like I said, with respect to the special permission or the authorization from the Office of the CMO, the documents that are required will be the CPP, the GMP, and we would have to get the artwork. It's listed in the submission.
So however, why would the DAC have missing information to be supplied?
And Chair, I'm not sure what would be missing information. So it is my understanding if you can supply it to the Office of the CMO and the Ministry of Health to get your one-time or how much time permission to import it, then those same documents should have been made absolutely available to get the document, to get it registered. So I am not too sure why that happened because I'm not part of the DAC, but that is something that we probably could look into and get.
So don't you find it alarming that the DAC would recommend this ultra-virus practice. And we agreed it's ultra-virus. There's no basis in law for it. We agree. There is absolutely no basis in law for the minister to grant any special permission. But my issue is this. Why would special permission have been granted, especially in the context where we repeatedly have missing information? And that's what's troubling me about this entire thing. But we'll take that up at the next meeting. So we're going to close and we'll adjourn to a date to be fixed. I want to thank everyone for their attendance and their participation. Mrs. Khan, might I apologize to you once again for dragging you here so many times that we just have not gotten to you. So what I will undertake to do is to inform you in an adequate amount of time whether we will require on the next occasion, if we propose to get to you, so that we don't waste your entire afternoon. Thank you very much, and my apologies. JJ? Yeah, that's that craziness. JJ?